Hey, let's go ahead and admit some people.
Absolutely.
Good. Good afternoon, everybody. So, hope we all are doing good. I went ahead and did mute everybody. So, if you're trying to talk to us right now, we will not be able to hear you. We're just going to give it another minute or two for any last minute people wanting to come on in before we admit them into our talk, okay? So just hang out for a couple of minutes. See everybody. Good. We're just going to go ahead and be starting here in a second. Muted.
Hi, I see that Barbara's on and Joanne
Yep.
and then Naomi Ward.
Mm-hmm.
This has her son, Juanita, Kathy. Great. That's neat that you have your names
Yeah, it's awesome.
on,
So we're
on
going
the
to go.
slide.
Yeah. So we're going to go ahead and jump in because it is 2 o'clock now. So good afternoon, everybody. If you don't know me, which I believe some of you do, my name is Sean. I've been with Healthy Aging for a little over almost a year now. And just welcome to our last virtual summit talk for this week. So we are on Friday, the 28th today. We're going to be talking with Dr. Robert McGrew, talking a little bit about infection prevention, okay, and how this kind of can tie in with a little bit of for COVID-19 as well. And we're going to have our expert speaker today is Dr. Bob McGrew. He has accompanied me and helped me out a bunch on Wellness Wednesday, and I just wanted to say thank you, Dr. Bob, for coming today.
You're welcome. I appreciate people checking in with us today. I think we'll answer questions at the end of the presentation. So please, any questions, remember, and Sean's going to unmute everybody and we'll chat towards the end.
Yeah. Okay. So we will dive on in a little here. Okay. So just to let everybody know, this session is being recorded. Okay. So if you're feeling uncomfortable at all, then just feel free to go ahead and turn off your video. The recording is going to go ahead and be posted on our website, and it'll be on social media pages along with YouTube. So if you miss the recordings through the week, or if you just want to go back and look at this one again, you can always go onto YouTube or our website to find those videos. All participants are going to be muted for this whole duration of this session. And then at the end, you can answer questions with, we can unmute and do that. And then we'll kind of jump into the questions. And if you think of any along the way, just shoot them in the chat box, and then I can ask them to at the end so you don't forget. Wanted to just throw out a special thanks to some of our sponsors, right? So Healthy Aging Association, right, is one of our big ones. Kaiser Permanente and the Stanislaus County Area Agency on Aging. They're great. They all did so much to contribute to our bags that I hope all of you have had a chance to get. We have a couple more from, the E&J Gallo Winery. We have a Central Valley Medical Group, Blue Cross California, Alignment Healthcare. There's a whole bunch of cool organizations that really chipped in to make this an amazing event for this week. And this just shows a little bit more of the special thanks to the sponsors. On top there, we got that Sutter Health. Just great that they all contributed so much to help us make this event what it really is. So it's good. Good. So event bag distribution. I hope you all had the opportunity to come on down to some of our many locations and get yourself a nice pink summit bag with lots of goodies in it. We are finished with them as of today at 11 a.m. So that was the end of the bags. Last one today was in series from 10 to 11. So I hope you all enjoyed that and then got your bags and a lot of fun stuff, okay? Because they are filled with some really cool stuff. For today's agenda, okay, so we're going to dive on into the subject matter at hand. We're talking about infection prevention. going to be held from 2 to 2:30, so we only have a nice little 30-minute window here to talk. We're going to be going over the introductions, which we just did. We're going to review and recap some videos that are posted on our website. Okay, you can find these on healthyagingassociation.org. We're going to have 3 points that we take away from these videos, and services and resources available that are here throughout Stanislaus County for you. And then just questions and answers. We do ask that you utilize that chat box again, and then just, send them towards me, and they can be read at the end, and we will try to answer as many as possible. Okay, so we might not be able to get to everybody's questions if there's a whole lot, but go ahead and feel free to ask away. So now we jump in and review some of the handouts that are on that website of healthyagingassociation.org. So these can also be found in your summit bags, okay? And they're easy to find on the website. All you have to do is go to the events tab and then click summit, and you'll find those links. First one is hand hygiene, and it's a web article, right? So it's, just a few points to take away is just some common sense things I think that we've all been taught throughout our life, right? So washing your hands. Make sure you're washing your hands before and after you handle food, especially before you eat any food. Try to wash hands if possible after being around others or shaking somebody else's hand or anything like that. Hand sanitizer is a good alternative if you don't have the availability of having soap and water around, right? So I know there's a certain percentage, and you want that higher percentage for hand sanitizers to make sure it's really killing that bacteria, though. Good. And for the other page is going to be a strong defense against the flu. So getting your flu vaccine, right? It's talking about getting vaccinated for the flu. We want to do that annually, right? So we want to make sure we're always staying on top of that to have that strongest defense possible against the flu. And it is that time of year again. So some reasons to get vaccinated. One is to, prevent the illness, prevent hospitalizations, and even deaths caused by those illnesses. Reducing the severity of the illness, right? So you're if you do get it, your body can fight it off a little bit easier than without. And just a tip that the flu virus is always changing, right? So you want to get the vaccine annually. That's what's recommended. And you want to make sure that you're staying on top of that so that you have the best chance to fight off that flu. Good. And with that, we're going to go ahead and dive right on in for Dr. Bob McGrew. We have this talking about the infection prevention, okay? And I'll let Dr. Bob take it away.
Okay, thank you. Let's go on to the first slide. We're going to be talking about focusing on COVID and influenza 19. Very timely topic because the end of October is traditionally in Modesto area, the start of the flu season. We normally see influenza, which is what I'm talking about when I talk about flu. We normally see that around Thanksgiving to Easter in Modesto, which is our colder weather season. And indeed, this virus does better during cold weather. And also it's transmitted more because we're closer together. So what do COVID and influenza share together? There are some similarities. And we're going to be talking about the fact that both of them could be very prevalent this winter, even though we've had a lot of COVID infections all summer long. We're thinking that there could be a winter spike once again. So common characteristics, they share the same kind of genetic material called RNA. They affect the lining of the nose, throat, and mouth. So normally, particularly with the new Omicron variant of COVID, both influenza and the Omicron actually infect our noses and throats, and then get down into the bronchial tubes. So that's common, and that's extreme. You can get really sick with influenza for those of you that had it. Now, let me be clear, we're talking about true influenza, a certain kind of virus. We're not talking about what people talk about when they call it about stomach flu. Stomach flu, you know, might throw up, diarrhea, you feel bad. That's really not a common symptom of influenza. We also talk about people just say anytime they have a runny nose and feel achy, they have the flu. But again, we're talking about influenza, which is a much more serious infection than most common colds and cough viruses, of which there are at least 100 other ones that affect humans. So in terms of true influenza, you can often get a high fever, muscle aching, and fatigue. And both are highly infectious in the sense that simply being in the same room with a person who's starting to have this illness or has this illness means you have a higher chance of getting it, although you have the highest chance if you're very close, which is within 5 feet or so. Let's go on to the next slide, Sean. So we talk about influenza. Now influenza goes into our lining of our nose and throat and bronchial tubes. But a key fact is that it doesn't go any further. It doesn't affect any other part of your body, not your kidneys, not your heart, not the lining of your arteries, not your brain. Whereas COVID affects all of those. Influenza, people die mainly from bacterial infection that gets into those inflamed bronchial tubes where there's a lot of mucus, and because your immune system is working so hard to fight flu, what happens is that bacteria can get in. Bacteria that normally live in your nose and throat have an opportunity to invade the bronchial tree, get down in the lungs, cause what we call pneumonia, which is bacterial infection of the lungs, usually starting in the bronchial tubes of the lungs. So antibiotics can cure this, but getting severe lung damage from the infection of influenza is not uncommon, and it can take weeks or months to fully recover, particularly for our over 70-year-old people who land in the hospital with influenza and bacterial pneumonia. Very common, hundreds of thousands of people a year in a bad flu year. Okay, Sean, next. Could be having a little bit of problem, I understand, with the slide set, but let me go on. Again, so what's different about influenza and COVID? The virus reproduction is not just in your nose, throat, and bronchial tubes. It's actually all throughout the body. And this is something that most people still to this day do not understand, even doctors and nurses. It's a very key difference because you can imagine if a virus can affect many organs in your body, and COVID affects virtually everything, including the lining of your gut down into your colon. So COVID causes more stomach issues, gut issues than influenza, for instance. COVID can affect the heart, and it can affect the kidneys. And actually, kidney failure is a common problem with COVID, or long-term kidney damage. So even if your kidneys recover, they're not as good as they used to be. It also infects the lining of our arteries and veins. So blood clots are much more common with COVID, say, than any other virus that I'm aware of. And a key problem after COVID is people have had strokes. Just a year ago, I saw a 44-year-old lady at the clinic that I work at that had a significant stroke and almost died. She was in the hospital 3 weeks, ICU 2 weeks on a ventilator post-stroke. So that virtually doesn't happen with any other virus that I'm aware of, to have that increased blood clotting incidence. Also, a lot of blood clots in the legs. Okay, so severe damage, COVID is worse. Let's go ahead and go to the next slide. So, given what happens from these viruses, let's start with influenza. Is it worth preventing influenza versus treating? Do we have such a great treatment that we really don't need to worry about vaccines or need to worry about, say, staying away from other people during flu season, at least being cautious about that. And the answer is an ounce of prevention is definitely worth a pound of cure with either influenza or with COVID. And we do have anti-flu virus medications, but a lot of people, just really feel lousy. People Sean's age, Sean's our younger person here. Your kids, your grandkids, for us older folks, they can still easily lose a week of work and feel lousy for another week or two, coughing, but able to go back to work. And that's a good reason to be vaccinated. In general, although you often will get some symptoms from influenza, even with the vaccine, in general, it's less serious, which means maybe you can work, you're off work less. But what about us seniors? Well, the 25,000 to 70,000 people who die in US during that's an average flu season with hundred thousands of people, usually 200,000 or more hospitalized. Guess which age group those are? Those are us, so, 65 and older. The vast majority, although you'll certainly see 40 and 50-year-old people who get hospitalized. We particularly saw that in 2009 when we had the H1N1 influenza epidemic. Okay, next slide. But what about COVID? That we've got a lot of new treatments for COVID. We actually have many fewer people dying of COVID now that would have died 2 years ago. No question, many people are surviving now that would have died. But a lot of those people who've been hospitalized and survived have long-term damage that's never going to recover. They had a stroke, they had kidney damage, they had severe lung pneumonia. One difference from COVID versus influenza is that COVID, it's the virus itself which does most of the lung damage. And there's much more residual scarring and damage in the lungs on average from a bad COVID infection than a bad flu infection. So since 2020, we've had over 1 million people of our fellow Americans have died. And I believe that number is very accurate. I used to sign death certificates, so I'm well aware of what goes into the signing of the death certificate and listing the causes of death. I think COVID was actually undercounted, not overcounted. And I also trust the integrity of the doctors who are doing signing those death certificates, the doctors and certified nurses who are doing that. We took an oath, to be honest, no matter what the political storms are up above us. Okay, so let's go ahead and go to the next slide. Well, Sean, go back to the last slide. And let's just talk for a minute. So COVID vaccines have worked. And I just want to mention that the COVID vaccines now, I have recommended the current booster vaccine for older people. I think at least people over 60 or anybody with a chronic illness should get the booster that's available now. It's a combined Omicron with the original strain. So it's called bivalent. We actually use the same strategy for influenza, where we have a trivalent and quadrivalent. So what does that mean? It means we've got 3 or 4 different, genetically slightly different types of influenza. The ones that have been recently circulating, we've got those in the influenza vaccination. Highly recommend getting the vaccination now if you haven't gotten it. Influenza is beginning to circulate in California. So October, November, early November are the best times to get it. Influenza vaccine doesn't stop, as I mentioned, influenza, and this is a good take-home point, but it greatly reduces the number of serious infections, hospitalizations, and deaths. Now, coming back to COVID, with the original variant in 2020 that came to the US, the vaccine was very good. It greatly cut down on transmissions, greatly cut down on people getting sick at all. COVID has changed rapidly in the last 2 years, such that the new Omicron variants that started in April in the US, um, people still get sick because they infect the nose and throat better than the original variant from 2020. So we still get sick with kind of a mild flu type of illness. And if you're older, you might get even more than that. You might still wind up feeling really lousy for several weeks, but you're less likely to get hospitalized. You're much less likely to die if you've been fully immunized. And um, uh, to me, that makes the really tiny risk of side effects with the mRNA vaccines a very good trade-off between the risk and the benefit. COVID has a huge risk. Um, so, so we encourage people to do that. Unfortunately, I know of a person I've met before who died in April of this year. Healthy guy, exactly my age, 70 years old. Healthy man, vigorous guy, died of COVID in April this year. And the reason? He didn't believe vaccines were necessary. He believed in natural immunity. And unfortunately, he was a good natural immunity experiment. So that's one of the reasons why, as doctors, we hear about these things, and it's very sad when it happens. Okay, next slide. So, in terms of physical measures, the second take-home point, first one being that vaccines work and prevention is an ounce of prevention is worth a pound of cure. The second is that physical measures did work, and we're talking about being 6 feet away from people who are symptomatic or may have been, exposed and incubating either influenza or the COVID virus. We're talking about increased airflow, so being outside is actually really good. Or being a large space with a lot of ventilation, a lot of air blowing through. Having windows open in a room where you're getting a big breeze is fantastic, because the breezes outside and in a well ventilated room blow the germs away from you, from somebody who's close to you. All right. HEPA air filters do work, but they have to be the airplane hospital level to really work for influenza and COVID. Normal house air filters are not real good in removing these viruses. Masks absolutely work. That's why we saw so little influenza in the last 2 years, is all the distancing from other people that we were doing, and the masks we were wearing actually worked really well to reduce influenza. So we think this year we're going to have a big influenza year because we're not doing that. And then isolation of infected people absolutely works. We've been doing this for hundreds of years. It's been known that keeping yourself away from somebody who's infected works. So what happened during the medieval times when the nobility had when smallpox or the plague, two terrible germs, would infect Paris or infect London? Well, the nobility all went away to their cottages, to their castles that were outside of town, because they knew they were much safer there than they were around all those ill people. Okay, let's go ahead and go on. So the third point for today is that healthy lifestyles help our immune system. And when we help our immune system, and this applies to, again, however old you are, 80, 90, it doesn't matter. When you have a healthy lifestyle and your immune system is working better, you tend to have a longer health span, which is our time when we're able to do what we want, as well as a longer lifespan, and less likely to wind up in the hospital with influenza and COVID. So Sean, go ahead. Yeah, and three things come to mind for me about healthy lifestyle. I think we have 2 slides for them, but one is sleep, and this is often overlooked. I know a lot of my older patients had trouble with worry and would wake up in the middle of the night and not be able to go back to sleep. They wanted sleeping medicines. Well, it turns out that 7 or more hours of restful sleep absolutely helps our minds. It helps our brain to think better. Uh, the brain actually needs to renew itself. And it helps us process our emotions better. We get less worried when we really have that good sleep, especially at night. But sleep interruptions are more common. We get up and go to the bathroom. We sleep lighter. Noises bother us maybe more than we were younger. So how do we improve our sleep? And sometimes having an app on your phone or a noisemaker, something that causes what's called white noise, for many people really helps. They have apps with all the noises on it, including waterfalls, including wind, including rain. That's really kind of neat. So I encourage people to do that. There's actually we could do a whole talk, Sean, just on how to sleep better. But that's a big deal. And Sean, go ahead. So stress is a big deal. So stresses, we can't avoid them, but what we can do is we can avoid worry. And one of the biggest things, worry is a choice. You say, well, I have this, I've always worried. I'm an anxious person. Well, it turns out you can learn to worry. You can learn anxiety from your parents when you're a little kid, but you can also learn not to worry as much. There's some good books written about it, but one simple thing to improve is a gratitude journal. So what's often called thankfulness or gratitude. For those of you that go to church, you'll recognize Thanksgiving or thankfulness as one of the key ways that people pray. And if you're not religious, it still works. So we actually encourage people to write down what they're thankful for today, and then to focus that when you get worried on what are you thankful for instead of what are you worried about. It has a tremendous help for your mood. Something we as older people, we have a lot of things to worry about. So something we really need to focus on. Sean, go ahead. I think this is our last slide. And this is really one reason why I wanted to work with Healthy Aging after I retired from full-time medical practice as a family doctor at Cornerstone Medical Group was that we promote some really good things: healthy nutrition, which is the slide we don't have, Sean, and healthy exercise. So we recommend 30 minutes a day of brisk exercise, whatever you can do. As you know, Sean's going to actually, I think, go over our programs right away. But walking briskly is the most common, but some of us can't walk. Some of us can do machines. Some of us can do just chair exercises, and Healthy Aging is here for you. Sean, so why don't you take it away?
Great. Thank you, Dr. Bob. That was a lot of great information. I really enjoyed that. That was great. I totally agree with you on a lot of those points for sure. So that was really good. So yeah, when we dive into some of the programs that we have in the local area around you, right, in Stanislaus County Healthy Aging Association, we have a few great programs. I know some of you here do participate in or have at least heard about. Exercises do help you stay healthy and can help build up that immune system too and help you stay strong and as healthy as you possibly can. So we have our Healthy Aging Young at Heart strength training program. And I put the time because in the last slide I saw that it was 30 minutes, right, Dr. Bob, of exercise, right? So this class is like an hour long. Most of our classes are about an hour. But the great thing about the strength training program for Young at Heart is that you can do it all from sitting down in a chair. Okay, so you really don't have to be fully mobile to get an exercise in, and it is a full body exercise too.
Good.
So you work out legs, everything. If there's plenty of modifications, if you are unable to do certain things, and it's just such a beneficial exercise program that not only just keeps your body healthy and everything, but your mind too. I think it's a really great program.
Absolutely.
Yeah, and then our other program I put on here for us was the Tai Chi Quan Movement for Better Balance, which I'm actually an instructor of here. And great program. This program really is focused on that fall prevention, but I wanted to put it in here because with that stress slide you had, Dr. Bob, I feel like
Mhm.
I've told my participants in my class every time I'm done with that class, I feel less stressed or at least less worried when I leave.
Absolutely.
All
Exercise
that,
does, any kind of exercise does that.
yeah, and just the
Mhm.
breathing and everything like that. So that's a really great program to think about too. We will be having a new one here starting hopefully here soon. And then I put in just to get out and walk if you can, if you're able to. Walking makes a huge difference. Um, and that's just a good way to get that 30 minutes exercise in. So it's a good thing to keep in mind that if you can't do these big exercise programs or anything, just get out and walk. Make goals to walk around your neighborhood if you can. Okay. And then for vaccinations and stuff, I just put in for Kaiser, the Modesto offices. And this is their phone number on the bottom, just in case if you were worried, if you were concerned and wanted to get the flu vaccine, or if you want any more information for COVID vaccines as well. And check your local pharmacies too, because they're all doing the flu vaccine and the COVID boosters and stuff right now. Great. This is the time when we will let people ask questions. So if anybody has a question, you could throw it into the chat box, or you could unmute yourself. I believe you should be
Yeah,
able
just
to.
go ahead and
Yeah,
unmute yourself. Sure.
yeah, I think you should be able to unmute yourself now. We have just a couple of minutes. If you would like to ask a question, just go ahead and ask away, or you can put it in the chat. If you're unable to get to work, don't worry. You can always send us an email after, and we could go ahead and answer your question the best we can then too. Okay. I know I have.
Emily,
What's that, Dr.
go
Bob?
ahead, Shine. Yeah,
I was gonna say I have one question that's popped up, I
sure.
think. So what would be some of the possible, like, those permanent side effects that could happen from COVID?
Right. So I think everybody feels that COVID has kind of become endemic, which means it's going to circulate every year like influenza does.
Hmm.
So to some extent, we've always underestimated the power of influenza. Again, 20 to 70,000 deaths, and a lot of them, uh, people who may have been elderly but weren't infirm. These weren't people who. Sometimes there were people who maybe are in. Excuse
Yeah.
me. Uh, yeah, sometimes these were people that uh, were in uh, were in nursing homes, but often not. So, anyways, with COVID, I think we're going to see an even more potent uh, infection compared to influenza in terms of the
Yeah.
number of people we lose every year, because it can mutate rapidly and because it infects all these other parts of the body that influenza doesn't. So we could be looking at 100,000 plus deaths every year, including this coming winter, and
Yeah.
many, many more people in the hospital, as I mentioned, strokes,
Yeah.
and heart attacks and kidney damage, and lung damage happening at a much higher rate than we see with influenza or with other respiratory illnesses. There are other viruses that people end in the hospital with, but
Mhm. Yeah.
influenza until now was the worst one.
Mhm.
So that's why vaccination is going to be important for both influenza and for COVID,
Yeah.
because it's going to reduce those, the people who get seriously ill.
Great. That was awesome. Thank you, Dr. Bob. All right.
Yeah. So again, our three thoughts were the vaccination definitely worked. We think that vaccinations. I mean, mainline doctors, family doctors, infectious disease people. We think that the precautions taken for COVID from 2020 till now have saved several hundreds of thousands of American lives. We would have had a lot more people die
Yeah.
without it, and we would have, because of that, we could have had hospitals failing. I mean, literally closing.
Yeah.
Yeah, and we just barely averted that in some places. So thankful for everyone who did, have vaccinations, did keep others from getting their infections. Uh, Yeah, go ahead. Yeah, oh,
Amazing,
and that's
great.
number one. I'm sorry, number
Oh,
two.
yeah,
I
yeah,
got
2 more
number
points, yeah.
two is physical,
Yeah,
physical measures.
mhm,
Do work, do work. So
yes,
during the season, traditionally during influenza season, and now we think COVID season is going to be the winter also,
mhm,
cool weather times. We recommended older folks be more cautious about being around ill people
mhm,
in terms of that 6 foot or more distance, meeting outside,
yeah,
wearing masks in stores. That all works for influenza as well as for COVID. So I think we're going to be seeing more of that. I wish we were like Hong Kong in
mhm,
this respect. Hong Kong had the initial COVID illness. So we call it COVID-19 because the original COVID illness, SARS-CoV-1, was in 2003 in Hong Kong.
mm,
And a lot of people died. It wasn't nearly as bad as what we had. It didn't pass between people very easily. And so ever after that, if you had a cold, if you had sniffles, if you had a cough coming on, if you were heavily exposed to a influenza virus or anything that looked like COVID, you wore a mask in public.
mhm,
Not the person who wanted to be protected, the person who was ill
yeah,
wore a mask in public and wore a good mask. They would wear hospital masks like are the best masks. I wish America was like that we had more concern for each other. And the last thought, I'm sorry, the last thought on that topic is simply that as a doctor, I wore masks for 40 years.
yeah,
I wore them in the ER. I wore them when I did surgery. I wore them to protect patients from me. Even though I wasn't even ill, just really tried to make sure that I didn't cause any illness myself to other people. So I think that is something we can do. And then the third thing was the value of exercise, diet, sleep, and managing anxiety with things like gratitude practices. And I want to thank Sean for hosting us today. And I think he's been a great addition to our healthy aging staff.
thank you.
And thank you. I know I've seen Barbara and Joanne check
Yeah,
in with several times
mhm,
previously, and then I see Naomi's there and Juanita,
yeah,
Kathy, and somebody else. We don't have their name, but thank you for staying
I think I
for the
know,
end
I
of our
think that's
program.
probably Marilyn maybe, so Marilyn, if that is you,
Okay.
welcome, and we are happy that you came and
Yeah,
um,
absolutely.
participated, and so if anybody missed any of the previous recordings and stuff, they are up on YouTube and our website. I got Juanita in chat saying, thank you, Dr. Bob, so
You're welcome.
um, if there's any videos that you wish to look at, there's some great talks about the diabetes, heart health, stroke, medications. I did Falls and
Mm.
Nutritions with a nutritionist, great gentleman that helped me with that. And a healthy lifestyle yesterday was with Sam, and today we're doing infection prevention. So if there's any videos you want to look over again or anything, feel free. You can watch them as many times as you would like. But with that, we are pretty much all done with our slides for today. So I'd like to thank you again, Dr. Bob, for coming on by and helping me
Okay.
out. All right.
Okay. Very good. Nice to work with you. Nice to see you, Barbara, Joanne,
Nice.
everybody else. Bye
Yep.
bye.